Hello, our lesson for today will be about autism. You will learn what is autism, what causes it, what are some common signs of autism, how is it treated, and do symptoms of autism changes over time. What is autism? Also known as autistic spectrum disorder, it is a range of complex neurodevelopment disorders characterized by social impairments, communication difficulties, and restricted, repetitive, and stereotype patterns of behavior. Autistic disorder is the most severe form of ASD, while other conditions along the spectrum include a milder form known as Asperger's syndrome, the rare condition called Tourette syndrome, and childhood disintegrative disorder and pervasive development disorder. Although ASD varies significantly in character and severity, it occurs in all ethnic and socioeconomic groups and affects every age group. Experts estimate that 3 to 6 children out of every 1,000 will have ASD. Males are 4 times more likely to have ASD than females. What causes autism? Scientists aren't certain about what causes ASD, but it's likely that both genetics and environment play a role. Researchers have identified a number of genes associated with the disorder. Studies of people with ASD have found irregularities in severe regions of the brain. Other studies suggest that people with ASD have abnormal levels of serotonin or other neurotransmitters in the brain. These abnormalities suggest that ASD could result from the disruption of normal brain development early in fetal development, caused by defects in genes that control brain growth and that regulate how brain cells communicate with each other, possibly due to the influence of environmental factors on gene function. These findings, however, require further study. The theory that parental practices are responsible for ASD has long gone. What are some common signs of autism? A baby with ASD may be unresponsive to people or focus on one item to the exclusion of others for long periods of time. A child with ASD may appear to develop normally and then withdraw and become indifferent to social engagement. Children with ASD may fail to respond to their names and often avoid eye contact with other people. They have difficulty interpreting what others are thinking or feeling because they can't understand social cues. They lack empathy. Many children with ASD engage in repetitive movements such as rocking and twirling, or in self-abusive behavior such as biting or head banging. They also tend to start speaking later than other children and may refer to themselves by name instead of I or me. Children with ASD don't know how to play interactively with other children. Some speak in a sing-song voice about a narrow range of favorite topics. Children with ASD appear to have a higher than normal risk of certain co-occurring conditions, including Fragile X syndrome, which causes mental retardation, tuberculosis, sclerosis, in which tumors grow in the brain, epileptic seizures, Tourette syndrome, learning disabilities, and attention deficit disorder. About 20 to 30% of children with ASD develop epilepsy by the time they reach adulthood, while people with schizophrenia may show some autistic-like behavior. Their symptoms usually do not appear until the late teens or early adulthood. Most people with schizophrenia also have hallucinations and delusions, which are not found in autism. How is autism treated? There is no cure for ASD. Therapies and behavioral interventions are designed to remedy specific symptoms and can bring about substantial improvement. The ideal treatment plan coordinates therapies and intervention that meet the specific needs of individual children. The earlier the intervention, the better. Education behavioral interventions, where therapies use highly structured and intensive skill-oriented training sessions to help children develop social and language skills, such as applied behavioral analysis. Family counseling for the parents and siblings of children with ASD helps families cope with the challenges of living with a child with ASD. Their medications. Doctors may prescribe medications for treatment of specific ASD-related symptoms, such as anxiety, depression, or obsessive-compulsive disorder, and other therapies. There are a number of controversial therapies or interventions available for people with ASD, but few, if any, are supported by specific studies. Parents should use caution before adopting any unproven treatments. Although dietary interventions have been helpful in some children, parents should be careful that their child's nutritional status is carefully followed. Lastly, do symptoms of autism changes over time? For many children, symptoms improve with treatment and with age. Children whose language skills regress early in life, before the age of 3, appear to have a higher than normal risk of developing epilepsy or seizure-like brain activity. During adolescence, some children with ASD may become depressed or experience behavioral problems, and their treatment may need some modification as they transition to adulthood. People with ASD usually continue to need services and supports as they get older, but many are able to work successfully and live independently or within a supportive environment. Thank you all. That is the lesson for today.